questions live. For our Good Gut members, we did have a question come in about eczema, but we're talking all things good gut, all things, what do we want to say? Integrative nutrition, plant-based nutrition. For
Gut health
those
nutrition.
gut health nutrition, for those that don't know, I'm James Marin, Integrative Registered Dietitian, Environmental Nutritionist.
I'm Dahlia Marin, Integrative Gut Health Dietitian, and we are Married to Health. So thanks for tuning in with us. We love doing these lives because it helps us really connect with you all and get to know what you're going through. We love speaking from an evidence-based perspective, our patient-based perspective, those in our Good Gut membership who are in our private group. And then this just gives us an opportunity to further connect with all of you. So thanks for being here. And we're looking forward to getting into some of these more nuanced things. And this is not medical advice. So please don't share your medical history. So this is not personalized medical advice. Hopefully, even if you are asking us questions, you have your own personal medical team and you have your own personal care team who you can go back and say, hey, I heard these dietitians saying this on Instagram Live, YouTube Live, Facebook Live, whatever. Do you think that this is something that would work for me? Because just because we're saying it doesn't mean it's for you.
I've seen some good questions come in. So yeah, put your questions in, whether it's in the comments below, or if you're watching on YouTube or Instagram or Facebook, we'll see them pop up. I almost want to put the chat on the screen. Possibly we'll throw that up on the screen as well. But we do have a question from one of our Good Gut members, and then I'm seeing some great questions. And just to comment on what Dahlia said, because right before this, we did an interview for someone's book, and we do a lot of Fridays are like our media days. Okay, so we're doing an interview and we're talking about just what you hear on social media a lot, and we're talking about how a lot of times, you know, the person that is talking to you through the screen is like, well, they're basing it all on themselves, right? Like, well, I feel good doing this, so everyone will feel good doing this. And what's unique about health professionals, especially I will tip my hat to any of the outpatient health professionals with their own practice, is that what we do, guys, what we do is really try to sift through the research, understand and absorb really, really great research from all areas, functional, integrative, Western, Eastern, like all of it, and then go, would this be a good protocol? And we do medical nutrition therapy, right? And so in that protocol, we then get all the patients in our practice to go, is this working for all of our patients? And really we have over 1,000 patients in our practice, which has been a huge milestone for us. In our entire career, as a decade, we're pretty much been dietitians for a decade, which is crazy to think about. We've seen thousands and thousands of patients. So it's really cool because then we get all that data from our practice and go, wow, a lot of our patients feel really great. So that is great when you have that backing behind you and you're not just going, well, I feel good. Don't get me wrong, all of you, I want to empower you to be your own researcher, be your own scientist. You are strong and smart and powerful. You can do research. You can gain knowledge.
You're the one who knows about you the most.
Exactly. But we have to all be careful to be like, well, this makes me feel good, so then I'm going to preach that as a blanket, like one size fits all. That is usually not the case. And again, this could be for someone saying eat more meat or eat more plants or don't, or take supplements, don't take supplements. It's not a one size fits all. Just want to throw that because I was inspired to say that. But cool. Let's just get right in, because let's get into it. Again, this is just open Q&A. We sometimes have a topic, we sometimes don't. So this is kind of just open. So we're excited about that. We see some questions popping in, but we also have a question from one of our Good Gut members. For someone struggling with eczema flare-up after moving to a new house and thinking it's the water in the area causing the problem, primarily, apart from filtering the water as a solution, what other gut-oriented solutions would you recommend? Really good one.
That is a really good one. And I feel like there's many parts to that. So you do want to kind of dissect it and think, one, is it the stress from the move? Because if we really think about what eczema is and what causes eczema, yes, the microbiome plays into it. And it really is an inflammatory condition. So there's something that comes along and it triggers this ongoing inflammation and immune response, where then somebody is going to have a flare of eczema wherever. People get on their hands, their face, their back, wherever it is that somebody is experiencing eczema. So, what was it that triggered your immune response?
Mhm.
What did your eczema look like before you moved? If you are somebody who never has had eczema and now you suddenly have it, you want to ask, what is brand new in my life? So, maybe it could be the water. That's a little bit different. Maybe the water is drying your skin out and that's causing dryness and irritation, inflammation. Mold could be another one. Is there mold in the house? Maybe that wasn't detected. Has there been a water leak or water damage? And that's if it's something brand new to you. Or maybe you're someone who's saying, I've had eczema before, it's been in remission, and now it's flared again. So, again, you want to still explore those two things.
Mhm.
You also want to consider moves are usually stressful. So, how has your stress level been? If it's not mold, if it's not the water, nothing significantly has changed in your lifestyle, you want to ask, how much is the stress of this move impacting my skin? Is this what's really triggering a flare? And is this shifting my microbiome to one that is a little bit more inflammatory? Because we know that that gut microbiome communicates with your skin microbiome. And again, it communicates with that interplay between inflammation and the immune system.
And then to dive deeper on eczema, which those are great general tips. And then this is still general. Again, this is not medical advice, but Staph aureus we know is a primary bacteria that's found on patients with eczema. So it seems like there's this almost you can call it a super bloom of Staph aureus. And you have to think what is that? And I like to make analogies so it's easy for all of you to understand. But it's this idea that well environment plays a huge role. And what I'm talking about is also there's a lot of links to vitamin D, which is very interesting. So we do have a skin microbiome. Our skin microbiome is that very similar to our gut microbiome in a sense that it's a delicate ecosystem, right? If something is thrown off on the skin or maybe a lack thereof of exposure, for example, your
Mhm.
ecosystem was that of a Southern California meadow and then you move somewhere dark and cold, whether that's up north or Canada or somewhere in Europe that doesn't get a lot of sun, that is a major shift for your skin microbiome, right?
Mhm.
So I think moving is a key, but similar to other ecosystems, what happens when you take let's say a forest or meadow from Southern California and move it to Denmark or move it to Canada? Well, you're going to then a lot of those animals and bugs and everything else that was living there might die off and then others take its place, right? So if you're like, man, I don't like mushrooms, but all that's growing is mushrooms and there's lots of slugs and because they like moisture and they like the wet and they don't like the sun, and you're going like, man, I don't want all these slugs and mushrooms and other creatures who like the cold and wet, then it's assessing like, okay, what am I doing for this ecosystem to maintain this balance? Am I taking my vitamin D? Am I trying to get that sun exposure? This is just one little facet of it, but it's thinking about our skin and our body microbiome as an ecosystem. And never really before in human history have we been able to make these moves so rapidly? Like literally, if you wanted in the same year, you could move from a cold climate to a desert climate to a jungle climate all within the same year. Sometimes it takes time for our body to catch up to this. And when our body isn't catching up, it can present as symptoms, hence eczema. So I hope that gives further
Mhm.
insight. What I would say to do is dive deep. If you haven't done labs, look at your vitamin D, look at your other nutrients.
Ask
Cont
yourself if you're intaking enough healthy omega-3 fats. So, do you have enough
Yeah,
EPA and DHA either in your diet or are you taking an algae omega? So,
right.
ask yourself if you have some of those things that help decrease inflammation.
Yes.
Antioxidants in your diet. Again, in the move, were you suddenly going from eating lots of whole plant foods to eating more processed foods just because
Mhm.
time was less, or maybe you didn't have a kitchen for a little while? So you want to really ask yourself, what increased my inflammatory load and what's maybe feeding into that Staph aureus that plays into eczema?
Yes. So I see more questions coming in. Where do you wanna oh, that's a good one, huh?
Do probiotics worsen SIBO?
We
There's
we have answered this before. So if you go our YouTube is a
mhm.
treasure trove, guys, and we try to dissect it in our YouTube shorts, but yeah, it's a treasure trove, but go for it.
I think there's a method to it. So it depends. It depends on what one's root cause is because we know
Right.
SIBO is not a root cause diagnosis. And really, at its root, SIBO comes down to either dysmotility, something affecting the motility, the movement in
Mhm.
your gut, making things more stagnant or making things a little bit too fast. It could come down to gut barrier integrity. Something has caused more inflammation, leakiness in your gut, or it can come down to dysbiosis, imbalance. Sometimes the imbalance comes from a lack of commensal or health promoting microbes. I see this sometimes with people who say, I went on an elimination diet, and we do know that that decreases the diversity in the microbiome. I took a bunch of antibiotics or antimicrobials, thinking that they were natural and herbal, and I just decreased and diminished the population of different species of bacteria and other microbes in my gut. In that case, if somebody, for example, is severely lacking lactobacillus, maybe they're not eating fermented foods, they don't have dairy in their diet, but they never replaced it with other lacto-fermented foods like lacto-fermented vegetables or other dairy-free products that have lactobacillus in it. They're not getting that really from a wide variety of whole foods. So maybe then including some lactobacillus would help. For the most part, though, and I will say, according to the American College of Gastroenterology, probiotics are not recommended while somebody has active SIBO. Rather, you'd probably want to wait until if you identify if it is SIBO and treat the SIBO. So you want to first try to eradicate the imbalance or, really get back to eubiosis or a place of balance with your microbiome. And then you want to try to add in, first, I always say with food, add in probiotic fermented foods. And if you tolerate those well, then you can try to kind of play around with different probiotic capsules. But the resource that I usually like to give is US Probiotic Guide, I believe. But that could be a good resource for you to look up which type of probiotic is right for you, because different strains and species will help with bloat, gas, diarrhea, constipation, nausea, vomiting, the whole gamut of it. So you want to make sure you're taking the right strain that you need.
Great. Well, you look for another question there. I'm going to answer this, and this one's very interesting. Is there any evidence that people that eat, I'll throw it up there, that eat a vegan diet tend to develop a gluten intolerance or celiac that otherwise wouldn't have manifested had they continued to eat animal products? I don't think I've seen a study like that, which is a very interesting study to do. I will make a note to look for a study like that, like specific in the vegan or plant-based population. Are they more prone? Essentially, what we're saying is the plant-based, vegetarian, vegan population more prone to develop gluten intolerance or gluten sensitivity, or even celiac disease, which is a autoimmune disease? I would say I haven't seen that, but I'd have to double check. I would want to double check that to see if they've done a study like that. I will say that I think when you do go vegan, there could be, how do I want to say this? There could be a lot of potholes on that road in a sense of going vegan or plant-based and even just refining your health, especially if you are doing this for health reasons. And typically you're doing this for health reasons because you're already experiencing some sort of symptoms that are pushing you to be like, hey, care about your health, right? A lot of times, a lot of people do that and go, I need to care about my health. Let me eat more plants. And then they start to go, oh, my stomach hurts, or I'm starting to feel funny, or my hormones are a bit wonky. Is that the plants you're eating? Is it other lifestyle changes? Was it something already building that you just didn't realize because you were kind of in that fight or flight situation of just surviving and using adrenaline and coffee and other, I mean, there's so many factors here. But what we do know is typically if you're already having gut issues, when you eat more plants or go vegan, you essentially eat more FODMAPs, right? You're eating more foods that are highly fermentable versus if you were eating the standard American diet, or versus if you've been on a more like keto, or I mean going way back like Atkins, right? Low carb. So when you switch to like, I'm gonna go vegan, I'm gonna go plant-based, you just eat more FODMAPs, right? Which are fermentable oligo disaccharides, monosaccharides, and polyols, right? That can cause discomfort, which then you go, oh man, is it gluten sensitivity? Is it gluten issues? You can get tested for that, especially celiac disease. You can get tested for that. If it is, I mean, you'll get pretty severe symptoms if it is
True celiac.
true celiac, right? And then that's another rabbit hole. I mean, but yeah.
So, yeah, just like James was saying, if I'm going to add anything to that, I mean, one, there's many causes for celiac disease. Yes, a large percentage of those with celiac do do carry genes for celiac, but that's not the case with everybody. So
Mhm.
it can also just be autoimmune, right? And we do
Yeah.
know many autoimmune diseases are caused from many different things, not from necessarily going vegan.
Right.
If somebody does go on a very, 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 very restricted vegan diet, sure, their gut barrier might be a little bit more susceptible and they might have more of that intestinal hyperpermeability. And that maybe might increase their chance of having an autoimmune response to the brush border of their small intestine, those little microvilli fingers that are in the small intestine. But that can happen with anybody. I've seen also those who go on any type of restricted, whether it's carnivore or keto, if you're really cutting out any type of different nutrient, if you're cutting out starch, if you're cutting out down a majority of fat, if you're cutting down protein significantly or soluble and insoluble fiber, that could increase chances for anything. So I don't think that the vegan diet, like James said, I didn't see any study on it, but I think any restricted diet. So if you maybe aren't on a properly planned plant-based diet, you might have increased risk for gut permeability, and maybe that would increase your risk for just any autoimmune condition. But we know other things can do that too. Stress, surgeries, injuries, viral illnesses can sometimes trigger autoimmune conditions. So, yeah, as long as you're really robustly and thoroughly planning it, there's nothing to say in the evidence at this time that that would increase risk.
Great question, though. That was a great question.
And I wonder if this person is asking that though, because maybe a lot of people decide when they are plant based, I think especially people who do it for their health, to
Mm.
try to go gluten free. So
Hmm.
I think maybe, that could be perceived as one and the same. I personally am a gluten free plant based person because I do have an autoimmune condition. I had it long
Wait,
before
are
I
you
ever went vegan.
gluten-free, plant-based, and you eat organic? Wow. You must live in SoCal.
But yeah. I'm not 100% of the time organic. I do when it's
I'm just
available.
kidding with you.
But yeah, I feel like, for me, because I had a pre-existing autoimmune condition, which led me to going plant-based, I just happen to be a gluten-free plant-based person, but I think that's not the case for everybody.
Mm. And
Love
then
that
follow-up
question.
that they commented, thank you. I'm asking because a friend challenged me saying he only knows celiacs that are
Oh,
vegan. Again, like we opened the live with, if we can catch the replay on YouTube, but we opened the live with, again, case studies. I only know people who are vegan that have celiac disease. Great, that's an anecdote, right? That's like your own perspective. That doesn't resonate with the data or with like facts, right? So we have to be careful with that. And even just being careful of who we kind of listen to, that can seed in your mind and play on your mindset and your energy of like, oh my gosh, do I need to go gluten free? And you start to kind of dwell in it and think about it. So yeah, be careful of who's planting thought seeds in your mind a bit, and just really get it from great sources. But I see that
I don't have
question.
celiac, and you don't have
No, I
celiac.
don't. I don't. Yeah.
And I have a lot of patients who are celiac and not vegan. So yeah,
Right.
interesting. All
Yeah.
right. Great question.
I kind of have a comment on that. What's the best multivitamin to take for easiest digestion? I
Hmm.
want to judo that question into saying you need to have great digestion when taking a multivitamin. Isn't that interesting, right? So
Mm.
we sometimes think of it, what's the best vitamin to take for ease? And I'm sure you mean like what's the best digestible multivitamin? I'm assuming that question is, right?
Mhm.
But I want to say you want to have amazing digestion for your multivitamin. So
Mhm.
before you even focus on the multivitamin, focus on your digestion and your gut health. That is essentially focusing on your lifestyle and food. So even before you get into the realm of multivitamin, unless you've identified like you're deficient
Or if you're
or
plant-based,
if
and
you're
you should be
plant-based,
supplementing B12, vitamin D, omega 3.
right. So those are the key ones that are heavily, heavily backed by evidence, but really focusing on a well-rounded gut microbiome for proper digestion. Because then I don't want to say you should do like throw anything in your mouth in terms of supplements, but anything you do intake will likely be properly broken down, absorbed, and utilized to its fullest.
But maybe you are somebody who is plant-based and you already have GI issues. So in that case, I usually will recommend liquid multivitamins if that's an option for people, because it's less work. Your digestive tract does not need to work on breaking down the capsule and the cellulose fiber or whatever else is involved in that capsule. So liquid if it's available. I do have some patients though who do not absorb neither capsule nor liquid. So maybe they're getting intramuscular multivitamin injections. If you're somebody who does have great digestion, or if you do absorb well, whether you have some IBS or gut issues or not, we like the complement essentials. That's a great one, especially for those who are predominantly or fully plant-based, because it really hits the needs of those who are plant-based. So we can put the link for that for anybody who's interested. But we like that one. It has B vitamins, it has B12, some vitamin D, algae omegas. It does have also some zinc and a little bit of magnesium and some of those essentials for those who are plant-based. So hopefully that answered that.
I'll go here. We have this question coming up. Could frequent burping, even when just drinking water, be a sign of some type of gut issue?
Yes.
Short answer, yes.
Short answer, yes.
But within reason. I mean, but again, it just depends. Again, this isn't medical advice. We don't want to freak anyone out if you're drinking water and you're like burping, you're like, oh my gosh, I have gut issues. But let's say frequent, it really just what is the definition of frequent, right? Like, is it an over amount? I mean, it's normal for a healthy person to burp up to 30 times a day. That's according to a 2020 study. So it's like, okay, if it's 20 times just drinking water, maybe that could be frequent, right? That would be a little bit abnormal. So it's really like, it's interesting because if it's abnormal to a baseline, which burping is healthy, passing gas, farting is healthy.
Flatulence.
I know, I like to say farting though, it's more fun. But these things are normal parts of fermentation. We are a microbial organism, and we have microbes that are working hard. Part of that hard work means gas production, right? So when it becomes painful, when it becomes abnormal,
something you can't control or hold in,
right? If it's linked to other symptoms you're experiencing, let's say you're diabetic or obese, or there's other things, then I would say yes, you want to factor that into your care plan, to getting that looked at. And it's just this important context. Overall, if you're really kind of lost, work with the registered dietitian, guys. And that would be really, really helpful. So
And I will say, with excessive belching, if it is abnormal, or whether it is normal or not, possible things to look into. One, are you swallowing a lot of air? So do you find yourself somebody who's constantly swallowing a lot of air when you talk or when you're eating? Are you eating too fast, causing you to swallow a lot of air? We do know also drinking through a straw is going to increase also the amount of air that you're swallowing. Drinking a lot of carbonated beverages is going to increase the amount of air that you are taking in, because it's carbonated, and that you're putting out. We do know, though, that in SIBO or IMO or SIFO, somebody with that dysbiosis could have overproduction of gas. And a lot of people think they are going to have excess flatulence, but they might have excess belching. So maybe that is dysbiosis, and that bacteria or other microbes are fermenting a lot of things in your small intestine, and then the closest exit is your mouth for them. So it could be dysbiosis. It could be something like gastritis. So it could be inflammation of the lining of your stomach. Maybe you don't have enough stomach acid, or maybe there's a little bit of an overproduction and you have reflux or LPR. So all those could be possible causes for you to look into and really, really test that out. But
you guys have some great questions.
Here's another one. Will dates worsen possible SIBO?
Ooh.
So we do know dried fruit is high FODMAP. There are fermentable carbohydrates in dried fruit, dates especially. Dates are so praised because they're a natural sweetener.
Which I love dates. I love dates. But even I do not suffer with SIBO or have gut issues. I limit my date consumption just from strictly energy overall look. It's not like, oh, we're saying dates are great, so eat an unlimited amount of dates. No, balance your nutrition for sure.
But if you do have SIBO, especially depending on the type, if you have methane IMO, or maybe you have hydrogen sulfide, or even hydrogen SIBO, studies have shown sometimes eating low FODMAP can be helpful for those various conditions, especially with methane IMO. So you probably don't want to be eating tons of dates, especially in the elimination phase. So maybe about those first 6 weeks. And then slowly, as you're introducing different groups, you can start trialing them out and see what your threshold of tolerance is. Maybe it's half a date, maybe it's 3 dates, but you would start trying that out. But until you've really identified what's going on, maybe you don't want to go too hard, too heavy on dates.
We have some. Okay, there's questions there. I like this is funny. I like the typing here. Do y'all happen to know how I can be part of these case studies? Smiley face. Have y'all ever applied to be in one? Case studies I was referencing are a patient. If you're essentially a patient of somebody, whether it's a gastroenterologist or a dietitian, you're kind of part of their case study. And what's really cool is, and this is something we want to do eventually, is we can post a patient study, a case study, to a peer-reviewed journal. And there are case studies in peer-reviewed journals. So really, you can ask like your care provider or someone you're working with to be like, hey, do you ever post case studies? And really, there's clinicaltrials.gov. If you're looking to be part of these are like clinical trials, not necessarily case studies, but there are other research studies. And there's like hundreds, if not thousands, going on at a time, looking for certain females or males or eating this type of that type, living in this area. So all kinds of criteria. So really cool if you want to go there. Clinicaltrials.gov, and it is NIH funded if you're in the United States. Yeah. Interesting question. We don't get that question a lot.
Yeah.
She said, LOL, I'm a Texan. I thought you were a Texan. I have family from Texas. I like Texas.
All right. Someone's asking, I'm having a terrible time with mag citrate motility. Doctor suggested with cramping gas build up. Do you know anything about BioOptimizer's magnesium blend instead? I've never heard of that one. With people experiencing cramping with magnesium citrate, you want to figure out why that is. Magnesium's mechanism of action is it's really going to relax the nerves that are in the colon, so that way the stool can pass a little bit easier, which is why it's one of the more utilized motility stimulators or motility supports, I will say. If you aren't tolerating it well, you do want to inquire, why are you having motility issues? At the root of it, what is the cause of the motility issues? Do you have pelvic floor issues, scar tissue, adhesions? Is it some type of neuromuscular condition? Is it neurodegenerative? Have you had an accident? Do you have an injury? Why do you need a motility stimulator? Is it dysbiosis that's affecting your motility, and maybe some of these gases are slowing down? What I do know from my experience is that sometimes my patients, especially those with significantly leaky gut who have developed histamine issues, they don't always tolerate the citrate in magnesium citrate. So sometimes I'll suggest that they try magnesium oxide and see if they tolerate magnesium oxide instead of magnesium citrate. And there's dozens of forms of magnesium. Not all of them are well absorbed in the gut. Magnesium citrate's very well absorbed, but if you don't tolerate it, magnesium oxide is another option. So I don't know about this brand that you're asking about, but maybe try magnesium oxide. Or there's other pro-motility agents as well. You can always ask your care team, should I use something like fiber powder, right? If you don't want one that's as soluble and as fermentable, maybe you're using psyllium. If you tolerate a little bit of a low FODMAP soluble fiber, maybe you're usually using partially hydrolyzed guar gum. If you tolerate acacia, you can try that. There's different laxatives sometimes that providers will recommend. I'm not a huge fan of laxatives. And then there are also other things that can modulate neurotransmitters like 5-HTP, which can help you make more serotonin. And then there are prescription medications like Motegrity, Percolopride, Trulance, some of these other things that help with stimulating gut motility. But you should really understand why you have poor motility so you can address that as you're trying to stimulate motility.
Wonderful.
All right.
Okay. Do you want to do that one? What is the difference?
What's the difference between prebiotics and probiotics? When to supplement one versus the other? Ooh, we have a blog on this, you guys. We will pin it in the comments below. But we did write with Food Revolution Network, who's an amazing organization. We wrote a really lengthy article on pre, pro, and postbiotics.
Yeah, pretty deep.
But James has a good analogy if we're going to really sum it up in a nutshell.
Yeah, for the sake of the live and time, I mean, you want to think of pre, pro, and post, and then there's a term symbiotic as well. But pre, pro, and post, you think of the pre as the soil, you think of pro as the plant, you think of post as the fruit or vegetable from the plant, right? So the idea is that prebiotics, you need healthy soil to then facilitate probiotics, which are microbes that are doing work and doing good for you. And then the good they're doing is bearing fruits, right? So you don't want to be a gardener with cruddy soil. And then even if you have great seeds, which is the probiotics, and you could think of you're buying the most expensive probiotics on the market, but if you're planting them in cruddy, dead soil, what's the point, right? So that's where you need a healthy foundation of prebiotics. So you have great soil and compost and mulch. Then, from the world in general, from what you eat, you'll get probiotics. You can also take some over the counter in the form of a supplement, great quality probiotics out there. And then you'll get postbiotics. And postbiotics are things that these bacteria and other microbes make for you and keep you healthy, right? So it's no coincidence that the outside world, especially a garden or an ecosystem, mirrors what's on our inside. Soil happens to be, this is where I love all these facts. Soil happens to be the most diverse ecosystem on this planet. Soil, like literally the soil in your backyard. It's more diverse in the micro than the rainforest in Brazil is in the macro. Hopefully that makes sense. But super diverse, and that's where majority of our microbes in our gut ecosystem is coming from. It's coming from our interaction with the outside world via food, via when you were a kid playing in your backyard with your pets, and with gardening or farming. So many ways we get these microbes. Even breathing, every breath. Take a breath with me. You just on average inhaled at least 10 fungal spores. And so that's not to say fungus is all good, but that's not to say it's all bad either. It's again that healthy balance in this ecosystem. So we are constantly being bombarded with microbes in one way, shape, or form. It's not fighting against them, it's working with them. So I hope I answered that question. I went off, but yeah, pre and probiotics was the question. But guys, yeah, where do we have that?
Soil
I think
and
in our definitely on our website, marriedhealth.com. If you go to our blog section, the link to that we'll pin it in the comments below for sure
on YouTube,
and we'll post it all over our social. So we'll make note of that.
Great questions. All right,
Where do we
someone's
start?
asking here. Some say being fully vegan is harder for stomach acid. Curious about your thoughts. Interesting. So
I wonder, harder in producing stomach acid, do you think?
I don't know.
If you can clarify that,
yeah,
let us know. But that's kind of general.
Our body is very intelligent of keeping a specific pH in our stomach, but there are things that can certainly affect that. So we do know things like hypothyroidism, autoimmune gastritis, where somebody maybe forms antibodies against the parietal cells in their stomach. There are things like gastritis, or even some cases of reflux where stomach acid is affected. I think people sometimes think that because maybe the proteins that are plant proteins are not necessarily as difficult to digest and break down in the stomach acid, and maybe they require a little bit less pepsin than an animal protein would. But I don't really feel like the body would necessarily decrease the amount of stomach acid or increase the pH of the stomach acid just because somebody is eating a vegan diet. But there are instances in which stomach acid can lower. So yeah.
Love it. This one? Oh, that's a good question. Is gut health related to arthritis? Quick answer, yes.
Well, it depends what
And
kind of
well,
arthritis.
it depends, but
There's wear and tear arthritis. There's just regular arthritis,
true.
and there's rheumatoid
Okay,
arthritis.
you're right. You're right. It's not as easy as
No, it
yes.
never is.
Okay, never is. I mean, yeah, but yeah. So is gut health related to arthritis? Yeah. If it's wear and tear, like if you've had, let's say,
A computer job.
a computer job, or let's say you've been running improperly, or you've been in a young athlete, just really bad form, and you've been wearing on your ligaments and your joints, you can get arthritis, and that's more of a physical, anatomical kind of degradation. If we're talking about rheumatoid arthritis, now
That's
is
autoimmune.
autoimmune.
And there are strong links of autoimmune with gut health. So if it's
Right.
rheumatoid arthritis or any other type of autoimmune arthritis or joint disease, then improving the gut microbiome can often decrease pain, and it can help to decrease the autoimmune response that one might be having. So, yeah, ask your care team.
Great question. I like
Yeah.
this one, or what do you think? Okay.
I think, will lower GI motility affect upper GI motility? Yes, it
This is Bella's
absolutely
jam right
will.
here.
It is. So our gut and our brain are always communicating with one another. And a lot of times when we are backed up down below and we do have slower motility in the colon because we're constipated, our colon and the stretch receptors in the colon is going to control that. There's something called the gastrocolic reflex, and it is a physiological reflex that controls the motility of the lower gastrointestinal tract. So when those stretch receptors are stretched, or those nerves are sensing that they're very stretched, they're going to send a signal to the brain to say, hey, slow down appetite, slow down upper GI motility. If there's someone trying to put more up from up top, I'm full down below and I'm having a hard time emptying out. And that's why a lot of times when we're constipated, we have less of an appetite. We have early satiety where maybe we're just a few bites in and we're like, oh, I'm full. Someone might even have nausea or vomiting and their body's like, don't put any more here. I have too much already to deal with. So 100%. If you are struggling with lower GI motility, it can definitely affect upper GI motility as well, and the frequency of those migrating motor complex sweeps, that little sweep that happens from top to bottom. So that will be affected, and that is communicated from colon to brain to small intestine and esophagus and stomach. Okay.
Great questions.
All right. So someone's asking, after dealing with acid reflux and then SIBO IBS, my symptoms got better, but the gas and smelly foul flatulence after eating never got better. This is a good question. And you want to really know, like, what came first? What's causing what? So hopefully you figured out what caused acid reflux, and you really want to try to understand, were you having reflux because you had SIBO IBS? That can often be the case. If you have a lot of gas and bloating in the small intestine, it can push on the stomach, and that can, by pressure, bring acid back up. Also, when you do have issues with the sphincters lower down, those little doors that separate the compartments of the GI tract, if maybe your ileocecal valve or sphincter is malfunctioning, it can decrease or change the pressure of the other valves where maybe they're opening or staying shut longer than they should. So you do really want to ask yourself, what caused reflux? Was it H. pylori? Was it a bacterial overgrowth like that? And if that's the case, H. pylori bacterial overgrowth in the stomach that affects the lining of the stomach, that can cause reflux, that can cause IBS, that can cause SIBO. Maybe when your body recognized there was more H. pylori, more of those other opportunistic and inflammatory bacteria also kind of took advantage, and they're like, hey, this body is struggling, they're down and out, now's our time to really take over. And maybe you then had more of an increase of those sulfur reducing bacteria. So maybe that was things like E. coli, Klebsiella, Dysolvibrio. There is a lot of different types of bacteria that, or other microbes that are sulfur reducing. So you want to ask yourself, do I still have a lot of these in my system? And if so, why? We do know one big factor that controls those sulfur reducers is your bile. So bile is that digestive juice that's produced by your liver and excreted from your gallbladder. And if you have a slow gallbladder, or if you have something affecting your liver, like non-alcoholic fatty liver disease or liver cirrhosis or something else, maybe you're not making enough bile to act as an antimicrobial, and that's keeping some of those sulfur reducers high. Maybe you have post-infectious gastroenteritis. You got food poisoning along the way, and maybe it was with one of those sulfur reducers, and that's still in your system, or their toxin is still in your system. So something to work on and something to consider.
I want to share a alarming statistic. Cholecystectomy is one of the most common procedures done every year.
And what's
1.2 million per year are done. And a cholecystectomy is gallbladder removal. Raise your hand, comment down below if you know someone or you yourself have had your gallbladder removed. That will definitely affect your gut microbiome. Now, again, it's not like all hope is lost, just give up now. No, that's not the case, but you need to be aware of the risks of having your gallbladder removed. This is something doctors or your care team should really, really take a whole body approach on.
Or your dietitian.
Or your dietitian, yeah, part of that care team can definitely help you understand. Very, very important.
And of that, pretty much females are 2 to 3 times at higher risk for having their gallbladder removed.
Yes.
Because of our higher levels of fluctuating hormones throughout our life cycle. So females are a large percentage of those 1.2 million gallbladder removals done every single year. So you want to check in with yourself. Do you have pain underneath your right rib often? That's where your liver and gallbladder are. If they're struggling, sometimes you'll feel the inflammation, you'll feel the pain. But if you're like, no, my liver, my gallbladder is fine, but I still have rotten egg smelling gas, maybe you do have an overgrowth of some of those sulfur reducers. So something to work on, again, with your care team or a knowledgeable dietitian or a care team who can help with this. All right.
Wow.
Great questions coming in.
You guys are on it today. Best foods for minor diverticulosis.
Ooh. So diverticulosis is really little pouching.
Just another warning, this is not medical advice. Yes. This is we try to keep it very general. Okay, go ahead.
So diverticulosis is little pouches that form in the, well, you can have diverticula of either the large intestine most commonly, or they can even form in the small intestine. And they're basically little extra pouches that form to make room for microbes and make room oftentimes for stool. And usually that is in the case of someone who's inflamed and or constipated. I see this very commonly, especially with those who have large intestine diverticula. The body is almost trying to make extra space for more microbes and more stool to be held in the large intestine. So before, you really want to work on foods that are high in fiber and foods that are hydrating to get your colon moving. Most of the time, when people are diagnosed with diverticulosis or diverticulitis, and they're told they have these diverticula, whether they're inflamed or not, they're told, go on a low residue diet, which means low fiber.
If you guys know us, you know we've been talking about this for a while, and it's one of our pet peeves, guys. It's one thing we learned in undergrad, and as we were training to become registered dietitians, we learned about low residue diets as MNT, medical nutrition therapy, is like, get them off fiber, and there was all these myths and misconceptions of like the fiber will get stuck in these pouches and cause issues. It's like, that's, very rare if at all possible. So it's like, it goes back to proper chewing and of course fundamentals. And again, everyone's a little different, but overall
eat the residue.
Eat your residue. You want I hate even calling fiber residue.
It's offensive.
Fiber is the essential carbohydrate, guys. You want to be eating fiber. We have a fiber deficiency linked to a soil deficiency, linked to other just very simple deficiencies here in the United States. Eat your fiber, guys. Eat your fiber. And it could be one of the most, if not the most, healing foods for any type of gut disorder. Again, there's a lot of nuance there, but overall, you want to eat the fiber. If you can't eat the fiber, then the mission is figuring out why you can't eat the fiber so you can eat the fiber. In any event, all arrows point to eating fiber in a roundabout way or a direct way.
And decreasing your inflammation. So So,
which
so,
fiber
so
will do.
important. And
Yeah.
somebody's even asking here, what would cause protruding lesions in your colon? Those are similar to diverticula. They're
Yep.
often kind of tumors, if you will, or polyps rather. And same, inflammation usually. And usually somebody's going to have inflammation when they're not having a high antioxidant diet and they have that imbalance of inflammatory and anti-inflammatory gut bugs, gut microbes.
And this is where we need one of our dietitians, Katie Chakos, who's a PhD and who's really interested in studying oncology, or she's finishing up her PhD program. She's an amazing dietitian on our team. So if you have more oncology, polyps, cancer questions, highly recommend making a visit with her. But really, at the fundamental base understanding of polyps or tumors or basically unwanted, unregulated growth, that's what cancer is, right? You have to think of why is the cell growing uncontrollably, right? And it usually comes down to it is lacking.
Your immune system is confused
Is
and
confused,
overwhelmed.
and you're lacking things to help give just the basic inputs for your immune system, for your cell function. And one of the big ones is short chain fatty acids, which happens to be a postbiotic, the fruit, right? In that analogy we gave. So short chain fatty acids are huge in regulating your immune system. Your body needs short chain fatty acids to help regulate cell growth. Short chain fatty acids can protect your DNA. So many benefits for this. So if you don't like cancer, if you don't want to get cancer, then you should love short chain fatty acids. And guess
and
what?
fiber
They are made by fiber.
residue.
Fiber, yeah, the residue, right? So it's like, it's so crucial, guys. It's so important. A great analogy I heard too, just on this topic with cell growth, right? It's like your cells are all like buddies. They're just one big family, right? All these cells are living together. We're all tight together, and they're like, oh, they're happy. Really what happens is a cell can just feel shut off. It's like a cell gets depressed one day
They're the black sheep.
and goes into the room and feels like I can't talk to anybody, no one's calling me, and oh my gosh, I'm freaking out. So it starts freaking out because it wants to be in contact with everybody. So it just starts replicating itself. It starts to replicate itself because it can't talk to anybody else. And it's like these cells just want to be in community. And whatever deficiency, so many things can happen that cause this almost illusion that it's not in community. So it starts to replicate itself. That is essentially a polyp, a tumor, cancer. If left unchecked, it'll just keep multiplying and cause a lot of issues. So again, very basic. There's more to it, but
So if we're checking in on ourselves, we're decreasing stress, improving sleep, eating more antioxidants and fiber, then we're coming in, checking in on them, being like, hey, your room's looking a little messy. You haven't gotten out of bed in a while. Can we spend some time helping you out?
Open the blinds for this poor
Yes.
cell and get them some sunlight, so to speak.
All right.
That's
Great question. So,
I'll probably take a couple more.
yes, we have so many, and these are great questions this time. They're always great questions. Somebody's asking, what are the best thyroid tests to get? This is a good
Healing
question.
foods as medicine. You got some great questions. You got a lot of questions. I love it.
So, for the general population, if you're not having any thyroid issues and you're not concerned, you don't have any thyroid disease that runs in your family, really you want to ask your care team to check thyroid stimulating hormone or TSH. And you can also ask them to check your total T3 and maybe free T4. And those are inactive and active thyroid hormones. If you are somebody who does have family history or suspicion of autoimmune thyroid disease, you can ask your care team to maybe check some of those autoimmune antibodies like TPO, TGA, if you're suspicious of low thyroid or hypothyroid. If you're suspicious of hyperthyroid, you can ask them to check TSI, thyroid stimulating immunoglobulin. But that's a conversation for you and your care team to have. And, there's controversy around this. I know it depends. Some providers will say, well, we only need to check TSH because it really only matters how much hormone your thyroid is stimulating. But I have autoimmune thyroid disease. So I've been told in the past by providers, well, it doesn't matter where your antibodies are. We know you have Hashimoto's. And I'm like, well, it matters to me because I can tell when they're much higher, I feel much worse. So I want to know where my antibodies are. I want to know if my lifestyle and the things that I'm doing to try to help it are bringing down my antibodies, that are balancing out my gut microbiome, calming my immune system. So I have less of that autoimmunity. So I'm speaking as a patient. That really matters to me, and I advocate for myself, and I make sure that I work with a care team who respects that. So yeah, it really depends on why you want them to check your thyroid.
Great.
Right.
A simple one. I like this question. How many grams of fiber a day do you recommend? And look, I mean, it's going like what is recommended generally is 25 to 30 grams a day. The average American's getting 15. So that's why I say we have a fiber deficiency. Fiber, you guys have, and let us know in the comments below if you heard of essential amino acids, you've heard of essential fatty acids. The word essential in front of a unit of food means that we just don't make it. So it's essential that we eat it, that we get it from our food, our environment, right? So in that sense, we don't make fiber either. Fiber is the essential carbohydrate. There's not many essential carbohydrates. Fiber is one of them. So you want to get fiber from your diet. It is essential. Now, what should you eat? There's some that say 50 is optimal. And so, yeah, I mean, I would say aim for 35. If you do a little more and it's in a balanced nutrition plan and you're properly plant-based, if you're plant-based and following just really, really good foundational key elements, you'll do great. I know I could speak for ourselves where I think we average 50 to 60. I know
50
when
to 75 when we're tracking. And if it's like a super high fiber day, we've even hit like 80 or 90 grams.
I've hit 100 in a day, but I don't think that's optimal. Not, I don't know. And it's interesting. You go back. This is where I love history in some ways. Or you go back to archaeology. We found fossilized poop of Native American tribes, and they were upwards of like 150 to 200 grams in their fossilized poop, or in their little poop rendering. So how accurate is that? I don't know. I'm not a archaeologist or paleontologist or anything like that.
That's dinosaurs.
Or that's dinosaurs. I don't know. But it's interesting, some of the studies that show our ancestors or people living before us were also eating lots of fiber.
And they were also very active. So
Very active.
if you're somebody who's pretty sedentary, you don't have a lot of physical mobility and motility, you might feel much more bloated with that level of fiber. Or if you're somebody with dysbiosis, other issues with motility, that might not work for you. But at minimum, really do want to hit that 25 to 30 grams of fiber per day, or
minimum.
Make sure at least 20% of the carbohydrates you're eating are coming from fiber. So that's another way to kind of estimate.
And if you're like, what does that mean? A quick way is just like eat whole foods.
Yeah.
Eat whole plant foods. If you're eating whole plant foods, you're going to get fiber.
And you're getting, definitely 25, 30 grams. You're getting more than that 20%. So hopefully you're doing that. Whole grains, legumes, you're getting fruits, you're getting starchy vegetables, you are getting nuts and seeds, all types of fiber.
Maybe one or two more. I like this comment. As a hospital doctor, shout out to Cooking on Purpose Health.
Yes.
As a hospital doctor, I've seen so many get cholecystectomies. And again, cholecystectomies are gallbladder removals. Again, 1.2 million is the figure, guys, every year. This was, 2021 study that looked at that. And we can get hospital data on this, guys. We have the data. That is a lot of gallbladder removals. Could it be dietary related? Could it be lifestyle related? 100% yes, right? Very rarely are we going, oh, it's my genetics that my gallbladder needs to come out. It is most definitely lifestyle related. There is the data and research to back that up. So yes, very important.
I saw a statistic. I can't find it right now, so don't quote me on this, you guys. But I did read something about the fact that I think cholecystectomies, again, I'll if I do in fact find this, because I might have seen it on Instagram, so I don't know if it's credible, but I know I saw this somewhere. I'll link it in the comments.
Dahlia's spreading misinformation, everybody.
I might be, so please don't quote me.
What are you saying?
But I want to say that I saw that around Super Bowl, I think they saw an uptick in cholecystectomies. And I think, again, people are eating super high fat foods. They're eating
what do you mean?
Chicken wings and pizza and hot dogs. And high fat diet is a risk factor. So hopefully you're protecting your gallbladder.
It's all the Super Bowl's fault, guys. If we just cancel
And the
the Super
holidays.
Bowl, then all that. No, I'm just kidding. I'm just being silly.
But all
because
year long, these things are happening.
I'm being silly because that's sometimes our mentality, guys, where we think of the association of like, oh, it's the Super Bowl's fault. No, it's the food's fault. No, it's not usually the fault of something that simple. There's more layers to it. It's about us being balanced. It's about us creating a lifestyle around us that promotes health. It should be easier to be healthy than to not be healthy. And that is kind of not the case for a lot of people. We've created a society where it's easier to be unhealthy, right? I dream of a society where it's easier to be healthy. You default to health, right? That would be amazing.
This is a good question. Is there any test to find out if you have issues with the pelvic floor? Yes. So I would ask your gastroenterologist or a pelvic floor physical therapist about that. There are many different tests and there are many different things.
Sorry.
There are many different tests that you can run. But that could include different types of scopes. So there are things like little probes that they can either put in the anus, in the vagina, in the vaginal canal to kind of understand how the muscles are working together. There's something called fecal defecography that really looks at how your muscles are working together as you're defecating, as you're pooping and having bowel movement. That's usually done by a gastro. There are ways to look laparoscopically, but that's very invasive because that's a surgical procedure. But most of the time, you're going to have that evaluation either with a gastro or a pelvic floor therapist. So there's many, many, many different ways that they can look at how your pelvic floor muscles are working together.
If you guys enjoy this, we enjoy answering your questions. Make sure you're subscribed to our YouTube, following, make sure you're on our newsletter, and that way you can come back. We do this once a month. Our Good Gut members get priority with their questions, but we then start answering questions. This is valuable. We are here to help. We want to see a healthier and better world. Our mantra is to heal with each meal. So we're going to continue for a little bit, but we usually round it out as we're approaching an hour, just because that's a pretty long live, but we love it. But again, just as a reminder, we do this once a month, our Good Gut Live. We also have a dietitian talk with all of our other amazing dietitians in our practice. If you want to learn more, it's marytalk.com. And we appreciate all of you. We'll keep going. I think. What do you want to do? A couple more
This
questions?
Is a good question. Hi, what plant-based protein powder do you recommend that is low FODMAP for IMO? Ooh, this is a really good question. You have several different options. You could go with one that's a brown rice. You could go with a quinoa. You could go with a white rice protein powder. Hemp is a great protein powder. My favorite is probably pumpkin seed protein. So I really, really like using just plain pumpkin seed protein powder, great amino acids in it. You might want to rotate them as well to just get different amino acids. But those are all really good options, I would say.
And as someone speaking without IMO, I mean, as someone, that's why we do like the complement protein. They have multiple sources of protein in one package, so that's really cool. You're getting various seeds and different plant-based protein sources all mixed together. But yeah, I wouldn't stick to just one, like a pea protein, right? I'm just gonna take pea protein and that's it. Like, no, eat your protein, eat a diversity, and even if you are supplementing with a protein powder, rotate it. If it is a pea protein, then switch to pumpkin. But again, in this case, you have IMO. Listen to what Dahlia is saying, and again, the goal with IMO should be, how do I not have IMO anymore? Let me overcome these symptoms. Let me get to the root of my IMO and go from there. So very, very important.
Yeah. And there are some pea protein powders that are certified low FODMAP. If you really want to be sure, Monash does certify products as low FODMAP. So you could always look on their website and see which protein powders are certified low FODMAP, or go on the Monash app if you want to be 100% sure. But yeah, those ones that I mentioned, all great options.
Yep.
All right. Let's do a couple more because we got so many great questions.
Yeah.
My kids, somebody's saying, is it terrible for kids to have sweets and milk for gut health? I grew up on it. For the most part, I didn't have gut issues. And my kids also have eggs daily. Is it terrible too?
Ooh,
Those
getting
are
some juicy ones. Eggs, milk, and sweets.
and terrible. I think out of all
Terrible.
of it, that's
No.
the thing that I took away. As a dietitian and somebody who really encourages people to have a healthy relationship with food and heal with each meal as well as feel with each meal, I think, again, your personal preference is going to be what works for your family. You're saying growing up, you didn't really experience gut issues. And we do know gut issues are multifaceted. It's not only
Mhm.
about what you eat, it's also about the stress that's in your life. So if you
Mhm.
grew up as with a traumatic childhood, you might have many more, and studies show you likely will have 3 to 500% more IBS than somebody without trauma.
Say that
So
again.
yeah, traumatic upbringing, and they did show multiple variables because trauma can be financial, it can be emotional, it could be physical trauma, it could be sexual trauma, but mental and verbal abuse were the highest risk factors for increasing risk of IBS. Again, IBS,
300 to
300 to
500%.
500% increase in
Crazy.
IBS in children who had early childhood trauma in the first 5 years of life. So that same person could eat the same diet. The person who had trauma could eat the exact same, milk, eggs, whatever sweets as a person who did not have trauma. And maybe they have symptoms and the person who didn't have trauma
Mm.
does. Maybe you were exposed to something. Maybe you grew up in a house with mold, or maybe you were not delivered vaginally and you were not breastfed. So your gut microbiome was a little bit different. So everybody comes into this life literally with different risk factors. How is your mom's microbiome? Whether somebody does have IBS or not, I generally encourage people not to use very emotional words with food. So things like terrible and bad and good and even clean, that that really talks, that can project on us, right? If you're trying to eat clean and you don't eat clean, are you then unclean? If food is terrible and you're labeling it as terrible and you eat it, are you now terrible, or you're bad, or you're good? So I really try not to think of food that way. I try to think of it very objectively as what generates inflammation for me or for my kids, and what's anti-inflammatory, because you're not suddenly going to become an inflammatory person. So that's going to depend on your family and what all works for you. We do know that evidence shows that predominantly plant-based is really what is most evidence-based. So whether that is 100% properly planned plant-based, whether that's more Mediterranean, whether that's something like the DASH diet, the Ornish diet, it could have that variability of 0 to 20% animal products in it. And there's a variability for the amount of refined food that works for you and your family. But I think, yeah.
So short answer to that, if you're getting 80% of your diet as plants and a really great diversity of plants, you're likely good. Again, this is very general. Okay, that was a short answer. Now, with that, are we going to say eat sweets all the time? And I mean, we kind of have to understand like these things have not been around that long. We're talking about hyper refined foods, right? In the span of human civilizations and just humans in general, hyper refined foods like high fructose corn syrup and sweets and candies and things like that have not been around. We're a tiny blip on the span of humanity. However, when it comes to dairy and eggs, that's been around a little bit longer. However, it matters in which the way we are raising cows and chickens today, right? The same milk and eggs of 2023 are not the same milk and eggs of 2000 years ago, or even 200 years ago, even 100 years ago. Things have drastically changed. So, again, this can be a whole rabbit hole. If you guys want us to go deeper into this, we can do another topic on dairy and eggs maybe. But I know eggs are very popular right now with the prices soaring and everything. But yeah, in general, 80% of your diet plants, there's a lot of great evidence to show that in terms of longevity, decreasing cancer, risk of
All-cause
diabetes, heart
mortality.
disease, all-cause mortality, which means all known causes of death decrease if you're at least 80% of your diet is eating plants. So again, with all I said, 0 to 20, the rest of it, whatever that is, I'm not saying go eat sweets as the 20% and just have 20% of your diet as candy. But hey, if 80% were healthy plants, maybe you
Whole
could get
foods,
a
yeah.
whole healthy plants. Maybe you could get away with that. I'm not saying do that, but yeah, there's so much variability there, but hopefully that was a nice answer for that.
And,
But
again, whether you're a child, an adult, if it's bringing you misery not to have any processed foods, and everybody's different. Some people feel amazing with zero processed foods. There are those, no SOS people, and they love it. It works for their lifestyle. It brings them joy and not stress. Great, be that mom. If it brings you stress and your kids hate it and they feel excluded, don't be that mom. Find where that
Right.
works for you. All right, we have a couple more questions, and then we're going to sign off, you guys, because we've been on already for an hour. What collagen do you recommend for vegan and vegetarian individuals? We recommend just getting in a variety of protein sources as somebody who is vegan and vegetarian.
Also, guys, you have to realize vitamin C, zinc, and other minerals and vitamins are key in collagen production.
Yes.
There's a reason why collagen is not an essential protein. We make collagen.
And we make it out of non-essential amino acids, meaning we can synthesize proline and glycine, those 2 amino acids that help us make collagen.
And if anything, red light therapy has been shown as getting more promising in studies that help you produce collagen. So red light therapy, and then just eating a really great diverse diet.
High antioxidant. Vitamin C is essential. You can't really make that on your own. So eat plenty of vitamin C sources, get zinc in your diet, eat a variety of amino acids. But, there are different products on the market. If you did want to, maybe you are on a very limited diet and you're like, I know I'm not getting in enough zinc and vitamin C. Either try to do that, or those can be things that you add with the support of your care team. Or if you're like, I'm not eating enough amino acids, work on ways, even if you have gut issues, to try to get in a larger variety of amino acids.
Should we do?
All right.
Oh, I like that.
Ooh, these are great. Opinion on plant-based yogurts with cultures for probiotics. Ooh.
If we press, we're doing some experimentation here.
Okay.
Oh, okay.
So we love them. We're big fans of these different types of dairy-free yogurts that have added bacterial and other cultures. These can be great for seeding the gut microbiome. So we eat them in our house. I will say 2 things to be aware of with dairy-free yogurts are, 1, the sugar, the added sugar content. A lot of the brands can add quite a bit of added sugar. And that, again, if you're trying to bring in these probiotics to decrease inflammation, but you're eating a bunch of sugar that's going to increase inflammation, maybe they're kind of negating themselves. Not to say the probiotics still aren't beneficial, but you want to think of that. Second thing to think about is saturated fat, especially if it's a coconut-based product. So I know I'm going to get haters. There's a lot of people who like coconut-based
get that question
dairy-free
a lot.
yogurts.
What do you think of? I'm not going to name names.
But yeah, studies have shown that diets high in saturated fat can increase likelihood of inflammatory microbes that increase leaky gut or intestinal hyperpermeability. So we'll speak to our favorite. I will say we have a favorite. We have a bias in our house. But after being vegan, plant-based for 12 years and trying the lot of them, we love Forager. We buy Forager in our home. We recommend Forager. It's mainly cashew-based. Does have a little bit of coconut in it, but the saturated fat is much lower than other brands. We buy the unsweetened regular or unsweetened vanilla, and we add our own fruit or our own, natural way to sweeten it. And they have great things like pourable cashew yogurt if you want to avoid the gums. They're organic. So we prefer to buy Forager in our house. Another brand that we like as well is, what's it called? Lava. Lava is peeling nut. That one is a little bit higher in saturated fat, though, than Forager. So if that's something that you're concerned about, something to pay attention to. But dairy-free yogurts can go into those 4 to 6 servings of probiotic.
Okay, I'm cutting Deli off. But if you guys want to know, I'm gonna leave you guys with a cliffhanger. If you guys want to know how Dahlia helped our dog's bladder infection naturally, she's amazing. She's a gifted practitioner for people and dogs. Apparently, our dog had a bladder infection, and she made him a protocol, and it worked. Like our dog. Yeah. Anyway, if you guys want to know that,
consult. But yes,
if you guys want to know how we did that, let us know in the comments below. Make sure you're subscribed. We'll maybe do a reel on it, or let us know, comment or DM us if you want that info. I'm leaving that as the last bit. But our dog's happy now. He doesn't have a bladder infection anymore.
And yes, Forager was involved. So
Forager was involved. Okay.
All right.
All right,
Great
everybody.
questions.
Again, we'll see you for our next dietitian talk and Good Gut Live and
Mhm.
anything in between. Make sure you're subscribed and go to marythealth.com if you want to work with one of our dietitians. We have 7 total this year, so we're excited. We have a big team and growing and building this integrative nutrition practice, so we're excited. So thank you all so much. Hope you enjoyed this. And as always, heal with each meal and feel with each meal. And
Thanks for your great questions. We look forward to the next one. Talk to you all soon.
bye, everybody.